Coming to you with some nice looking nails because I get plenty of biotin in my diet from great healthy natural foods. It's Wellness Nerd Out time! What's going on, you guys? Happy Wellness Nerd Out time. J-Mo, come on, buddy. Come join us. He always joins us. What's up, you guys? Happy Wellness Nerd Out time. Happy today. Happy Biotin Day. So, without further ado, let's get right into the good stuff. So when we talk about biotin, aka B7, I think actually another name is vitamin H, interestingly enough. But we know it as biotin or B7. I'll talk about the origin first. Originally extracted from yeast, biotin is a general cofactor for enzymes in the body. All right, and we'll talk about one role as a cofactor in a second here. But when we think about biotin, what do we think of? Well, as I mentioned, the nails. Hair, skin, and nails, right? We always think of hair, skin, and nails for years and years and years. Everybody takes a biotin supplement for the purpose of improving the health and aesthetic appeal of their hair, skin, and nails. And this really, all the evidence for this comes from one real pilot study done many years ago in humans on women with brittle nails, and they used 2.5 milligrams of biotin, 2.5 milligrams, that's right, of biotin, which is a lot more than the adequate intake or the daily recommendation of biotin, which we'll talk about when we talk about dosage here in a little bit. But this showed improvement with their nail health and the look of them, right? In simple, right? Aesthetic appeal. So that's kind of where all the hype came from. Now, aside from that, there really isn't much evidence in humans that biotin plays a major role in the health of or aesthetic appeal of your hair, skin, and nails. So that's really the only study that has any evidence for that in humans, at least. When we talk about some other stuff, so we mentioned biotin is a cofactor to enzymes throughout the body, and many different enzymes, but one way that biotin functions as a cofactor is in glucose metabolism, and this is very interesting because they did a study in mice that showed with increased biotin supplementation, it increased insulin levels in the presence of blood glucose, and it did this without increasing insulin resistance. And so we kind of see this, at least from a doctor's standpoint, as something that, is a potential implication and a potential treatment for people with diabetes, at least in part, among many other things, right? But it could be a piece of that pie in terms of the treatment. It could biotin supplementation. Again, increasing insulin levels in the presence of blood glucose without increasing insulin resistance. Now, the study I just mentioned, like we said, was done in mice. So, does everything translate over from mice to humans? No, of course not. We're totally different, right? But there was a study done in humans that showed that these symptoms of diabetic neuropathy or peripheral neuropathy due to diabetes, and we'll talk about peripheral neuropathy here in a second. I promised we would yesterday, right? As we touched on it then. But the symptoms of 3 diabetic patients with diabetic neuropathy were attenuated with biotin supplementation. So very interesting there. Maybe there is some promise in research for biotin treatment for at least diabetic patients with neuropathy, and again, attenuating their symptoms. Now, aside from that, what we're going to talk about here is neuropathy in itself. So what is a peripheral neuropathy? Well, when we say a peripheral neuropathy, we just mean damage, obstruction, or interference to our peripheral nerves. And this can come from a number of things as causes, such as infection, injuries, inherited disorders, toxins, metabolic disorders. But again, one of the most common causes of peripheral neuropathy is diabetes. All right, diabetic neuropathy. So, at least in the United States, where we get a lot of type 2 diabetes because we have terrible lifestyle and diet habits, at least for the most part, right, for the average American. So what is the amount of biotin that we should be taking per day? What are we looking at? Thank you for tuning in. We'll catch you in a minute here. Well, we talked about that pilot study that was done on women with the brittle nails, and it was 2.5 milligrams. Now, this is much higher than the adequate intake or daily recommended dosage, which is only 30 micrograms. 30 micrograms in both male and female adults over the age of 18, as well as pregnant women. If it's a lactating woman, then 35 micrograms. So still not a whole lot more, but a little bit more. So it's still a matter of just a few micrograms, right? Having said this, higher amounts of biotin have been taken in studies, especially for people with a B7 deficiency, and these dosages have gone up to 10 milligrams. So, and they've had no adverse side effects. So you could take a decent amount, and you should be fine. It's not my recommendation. I say just stay around the adequate intake. I mean, you get a lot from food, and we'll talk about those food sources in a little bit, baby. Don't think we won't. But again, it's pretty low, especially relative to that pilot study and what they give to people with a deficiency. So if you have a peripheral neuropathy in itself, not to get too off topic here, we're talking about biotin today, but if you have a peripheral neuropathy, what are some symptoms you might have? You might have numbness, you might have burning, you might have tingling in your hands and feet. And one classic example of a peripheral neuropathy is carpal tunnel syndrome, right? We know that numbness, that tingling that kind of goes into the lateral 3 digits of the hand on the median nerve distribution, right? And we won't get too into, anatomy and things like that, but that's a classic example that is definitely worth mentioning. You have to mention it if you're talking peripheral neuropathy. And again, we said B6 deficiency could also be a cause of peripheral neuropathy, and B6 supplementation, as we talked about yesterday, may be able to help as well when we talk about a peripheral neuropathy. All right. But today we're talking about biotin, B7. And so what are some things that could lead to a biotin deficiency in itself? Well, alcoholism is certainly one. Drugs are another one. In particular, prescription drugs for epilepsy. So that's I think pretty interesting. Drugs given for epilepsy sometimes have been shown to cause a biotin deficiency. Of course, other things like malabsorptive disorders, inflammatory bowel disease. I do that because it's like we say this every day. But, autoimmune diseases, anything where you're not absorbing nutrients properly, things like that, they can play a role in deficiency of really any vitamin. But one very interesting thing in particular that can contribute to a B7 or a biotin deficiency is drinking too many raw egg whites. Drinking too many raw egg whites. I believe it's because of the avidin in it, but, I'll have to double check that. But if you want to look into it yourself, if you're somebody that drinks raw eggs because you're too lazy to cook them, like I used to be, really it was more for efficiency. I'd be like, it's the morning, I want quick food, give me like 8, 9 eggs and I feel good, all right? But then, I could be depleted in B7 because I drank all these raw egg whites. Now, very ironically, as we roll right into the food sources here, nearly top the table are cooked. That is, cooked egg yolks. So again, it's like raw egg whites. I laugh. I just think it's so funny. I think it's so ironic. Raw egg whites, drinking too many could cause a deficiency, but like the best source are egg yolks. They contain 10 micrograms of biotin per egg yolk, per single egg. So a good amount there. It's about, a third of that daily value for adult males, females, and pregnant women, right? And when we say adults, we mean 19 years of age and older, of course, because that is 30 micrograms, right? So it's about a third. On top of your cooked eggs and the yolks in them especially, we have beef liver, we have pork, we have salmon, we have mushrooms, we have walnuts. Sweet potatoes are another one. Milk is another, and bananas are another great source of biotin that you can get from the diet, people. So you really don't need... Thanks, Nat. You're great. I'm really looking forward to it. I can't believe I'm going to be 30 years old. It's actually really scary. Guys, this is the last night of my 20s. I'm talking to anybody on When Wellness. That's actually like freaky. But that's not what it's about. It's about biotin today. So there you go. I hope you got something out of it, my fine feathered friends. What's up, Natty? What's up, Matt Miata? And what's Evo? Up, Evo. Thank you guys for hopping on. Love you guys. That was a great one. And tomorrow we're going to have a great day talking about vitamin B9 folic acid. So if you want to hear some cool stuff about that, you stick with us then. Be sure to tune in, baby. Have a fantastic rest of your night. We'll see you tomorrow, folks. And happy When Wellness. Good night.